right, so where's your hip hurt?
Well, just
There?
kind of everywhere, but especially this one has always hurt more on the outside instead of
Not so much in the groin?
Right, not so much in the groin as far as where I perceive it. So it's really seems outside, and to where sometimes I'm, I know it's my hip, but yet I'm kind of like, do I have a bursitis or do I have,
Probably all of it.
Yeah.
Is it really stiff?
It's really stiff. And then just, this has been going on for at least, maybe almost 3 years. And it's just been progressively getting, worse. Much, much worse. It's at a point now where just normal straight walking with very short steps, it's not horrendous, except I get kind of tired, or it gets tired. I stop and just kind of rest it for 15 seconds more. But rotation is, trying to turn.
And how's this one doing?
This one, you replaced this one, it was 3.5 years ago. Oh no, it's perfect. It's perfect. That, this one, and I may have told you this at a follow-up visit, but I even hit some golf balls in the third week. I didn't play a full round, but I just chipped and putted, and it was great. I was working it 2 weeks.
Let me have a feel here.
This one. Okay, I was making sure.
Look at that rotation there. That's fantastic.
All right.
I'll be more gentle with this
Yes,
side.
please.
How's it?
It goes, but it, right there,
Another one too.
right there it hurts.
Oh, yeah. Oh, there's no movement there at all.
Yeah, it's.
How's the strength? Push on my hand. Can you go in?
I think strength is decent.
That way. Yeah.
It's not decent trying to go up.
Right. Yeah. Well, I think it's pain and stiffness, huh?
Yeah.
So we see your hip replacement over there. That looks great. That's what it's supposed to look like over here. But there should be a dark space between the ball and socket, which is completely gone. Which is why it's so stiff and you have such bad arthritis and pain. So the plan will be for the same on that side. Anterior hip replacement. Go through the muscles, not cut any muscles, and hopefully with the same result where you're up and moving around and doing well really quickly.
Yeah, in the 3 years, would you likely use the same as you did on the other one, or has there been something new?
It will look a little different, yeah. So the stem we use now, the research has shown it doesn't necessarily need to be this long, so it kind of looks like that.
Okay.
Without the other part, but other than that, the socket looks the same, and the ball is still a ceramic, and there's plastic in between the ball and the metal socket. Other than that, nothing much has changed besides just the shape of the stem, really.
Okay. And is the typical, in terms of the hospital stay, you would anticipate it's just one night?
Probably 3/4 of people are going home the next day. Like today, I got to the hospital at 1 o'clock, and the lady that I had done her surgery the day before was like sitting in her chair waiting for me to come discharge her.
Yeah.
So yeah, but and there's some people that just a little bit slower to go, and they need an extra day, but it's fine. And of course, you've been working with the prehab program, and that helps a lot after surgery.
Yep. Just getting going on that. Those exercises are straightforward and easy. So, easy meaning not difficult to figure out or how to do them. And it's just a matter of just doing them.
Yeah, exactly. And I'll tell you, even though you're a professional and everything else, you know this area a lot. It's been surprising to me how much better patients are after surgery now. That you can tell who's done the visits ahead of time and who hasn't.
Yeah.
That's a big change. So it's worked out much better than I ever thought.
Yeah.
All right, and you've had your medical clearances done, and
everything is
all right.
Excellent. Looking.
We'll see you surgery. You're gonna do the prehab and hope for just as good of a result this time.
Yep, absolutely. We're gonna have the same result.